Hey guys, we're going to talk about how to do a dressing change for your peritoneal dialysis patients. So the supplies that you're going to need, you're going to need sterile gloves. You're going to need a tegaderm, one of your IV tegaderms that has the slit in the middle. Your no-sting barrier, whatever you use on your unit. A sterile 2x2, it can be the regular one or the split gauze, either one is fine. Saline wipe just to wipe off, because we always clean with betadine on our patients, so we don't want to leave it on the skin. And then you need betadine, which now we have the swabs, so please feel free to use the swabs. It's a little bit easier than using these lovely squares. So the first thing you're going to do is you're going to set up your dressing change. So you're going to open up your sterile gloves. You're going to open your saline wipe. If you have a friend at the bedside with you, they can hold these for you so you can pull them out. For right now, I'm going to sit them on the edge, which we would prefer you not to do. And you're going to open your betadine. Your no sting barrier you can drop on your field. Your sterile gauze. And your tegaderm. So now that you have this set up, while you still have clean gloves on, you're going to come over to your patient and you're going to remove the previous dressing. So reasons why we might remove the dressing is if you see leaking, if the tegaderm's coming up, or if you see a whole bunch of redness and we just need to observe the site. So once you've removed your dressing, you can use alcohol, any of your skin prep, or adhesive remover to help remove. And then you're going to want to observe your site. So things we're looking for, we're making sure that it's not red, that it's not leaking, and there's no skin breakdown. If you see any of these things, please notify your physician, because we actually don't open this dressing a lot, so we don't get to see the site a lot. So a lot of times the physicians like to see what the site looks like as well. So now that we removed our dressing, we're going to come over here. We're going to take off our clean gloves, put on our sterile ones. And then we want to clean. At this point, your friend would help you, or if you have the sticks, a lot easier, you will stay sterile. So for the sake of this video, that was sterile. So you're going to clean really good around the skin. Scrub, remember we want to use friction. Clean really, really good. And then you also want to clean up your catheter as well, because we want to get that bacteria off. You want to let this dry for 30 seconds to a minute. Betadine does take a little longer to dry, but that's how we get it to work. At that point, either your second person, or if you've dropped it on to your sterile field, you'll get your saline wipe. We're going to say we dried, and you just want to wipe off the betadine. The reason we want to wipe off the betadine is we don't want to leave that on the skin, because it can be harmful to any of our patients' skin. With one of your sterile 2x2s, we want to dry that site, just because with that saline wipe it'll be moist and then your tegaderm won't stick. If you have a patient that is prone to leaking, you can actually use 2 of these gauzes to kind of help make a pressure dressing underneath that tegaderm. You now want to get your 3M or your skin barrier, skin prep, and we'll clean really good, or we'll go really good around the site. Remember, don't put it on the insertion site, just around the skin where the tegaderm will be. You then want to get your 2x2 and fold it into a little square, just like this, and you will place it over the insertion site. You will then get your Catheter, and this is where it can get a little tricky because you're having to maneuver your gauze. You want to make sure that the little slit is going out towards the patient where your transfer catheter is. You want to pull the site really tight. As you can see, I kind of missed my transfer catheter, but you can manipulate a little bit and put your Catheter down. You then will take your Catheter off. Oh. Does not want to come off today. You will then take your pants and make sure that you get this hole covered. So you can go up and over or under, whichever works for your patient. We're going to attempt to go under to secure this hole that's left, like so. Then the last thing you want to do is you want to date, time, and initial in this spot here, and then you'll secure it over the last little hole. And that is how you do a peritoneal dialysis dressing change.